It is our distinct pleasure to welcome you to an interview for our program here in Diagnostic Radiology at the University of Ottawa, and we look forward to meeting you shortly. I'm Raman Verma, and I'm the Residency Program Director here in Ottawa. During the interviews, we will have a resident drop-in session so that you can ask any questions that might come up. The primary teaching site for our program is the Ottawa Hospital. It is divided between the main general and civic campuses, with the Riverside campus catering to more of an outpatient population. We have almost 60 radiologists, mostly subspecialized and covering every body system. We are a moderate-sized program with just over 30 residents and also have fellows throughout all of our major sections, contributing to the academic mission. We have a dedicated physics department and dedicated research department as well. Really, it's these people that help make up who we are and help to provide an unbeatable learning environment. The Ottawa Hospital is a large academic center, and with that comes exposure to all types of cases and a huge number of scans. We are the referral center for Eastern Ontario for most subspecialty services and the region's main trauma center. We have a number of affiliated sites. CHEO is the main children's hospital in Eastern Ontario with over 500,000 patient visits and 75,000 ER visits. This is where our residents do their PEDS emergency room rotation and PEDS radiology rotations. To round out the clinical exposure, we also have a variety of community hospitals, which is just as important to learning as our complex tertiary cases. We are also continually expanding our community electives opportunities. In addition, we are also the referral center for Kikatani General Hospital, which is in Iqaluit, again rounding out the learning experience. We are so lucky to have a core team that helps run our program, with program director, the associate program director, as well as our program administrator, who is instrumental in ensuring the day-to-day functioning of our program and is usually the first point of contact for our residents. Recently, we also expanded our team to include an educationalist to help develop our Competence by Design program. Without this team, we really could not have the successes that we do in our residency program. But beyond our core team is really our faculty and who make up some of our rotation supervisors in each of the different body sections. These are individuals who are truly dedicated to the education mission and ensuring you get the best teaching opportunities possible. A little bit about the program. It may not seem relevant, but it is something that is really important. Our program is fully accredited by the Royal College in 2016. Our next regular follow-up is set for 2024, which is a routine assessment after having achieved full accreditation. In July, you will be enrolled in the new CBD program. This is a shift in how medical education is delivered, coming from the Royal College, and has been implemented in all radiology programs across the country since July 2022. There will be a lot more about this once you start residency, but a brief overview. Residents will begin in the first stage, which is the transition to discipline. This is equivalent to the first PGY1 year. After that, residents move on to stage 2, which is the foundations of discipline. This is where residents will move into radiology full-time and integrate a broad range of knowledge and skills that are required for all residents. After that, we'll move on to stage 3, which is the core of the discipline. And this makes up the bulk of radiology training. And if you wanted to equate it to the current residents, it would be residents in PGY 3 and 4. Followed by this will be stage 4, which is the transition to practice. And this is equivalent to our PGY 5 residents who are getting ready to either go into practice or start a fellowship. You will become integrated into our residency program, and we will have 2 streams of residents. The time-based stream will be our current residents that will be in years PGY 3 to 5, and you will be entering the CBD stream, joining 7 current residents. The biggest change you will see is a shortened clinical year in PGY 1. We will be reducing the clinical exposures to relevant surgical and medicine experiences with an earlier and integrated exposure to radiology. This will be a huge benefit to residents entering and allow for a more fulfilling experience learning radiology early on in their PGY1 year. To expand on that a little bit more, here is how the different stages will be split up as you progress. As you can see in CBD, the stages extend beyond the traditional PGY system. Transition to discipline is an exposure to your core clinical rotations and will be the first stage in which you will enter. There will be a total of 9 blocks comprising the initial stage for CBD. This will include 8 clinical rotations and 1 diagnostic radiology rotation early in the clinical year, as well as exposure throughout the stage to the radiology curriculum via rounds and academic half-days. The clinical rotations will include mandatory rotations, 1 in each of pediatrics ER, general surgery, general medicine CTU, adult ER, intensive care, and radiation oncology, as well as a 1-block selective in surgery, which can be chosen from orthopedics, neurosurgery, or vascular surgery, and a 1-block medicine selective between respirology or neurology. The general radiology rotation is something that is new and was created for the CBD curriculum, and feedback has been very positive. It rotates the resident 1 week each in MSK, chest, neuro, and body imaging, with time for self-study and clinical work. Unique experiences include early integration of the scan trainer and working with the technologist, something the residents have really enjoyed. In Foundations, the focus of this stage is the development of the knowledge and skills required to integrate clinical and imaging information in the evaluation of common and/or acute patient presentations. The essence of this stage is preparation for independent on-call activities. This stage encompasses 7 core radiology rotations, including body CT, in which you will have 2 rotations, acute ER, chest, MSK, neuroradiology, as well as ultrasound scanning. It allows continued dedicated access to the ultrasound scan trainer simulation tool to practice scanning skills, as well as registration to the preparation for call course, and a robust on-call preparation curriculum with case-based and didactic lectures, including teaching from senior residents and buddy on-call spanning over 7 blocks. Residents can expect to start independent on-call around September of their PGY2 year. The last 2 stages we won't go into great detail, but following that will be the core stage, which is the brunt of radiology learning, spanning PGY 3, 4, and 5. Here you will rotate through each of the different systems and modalities to get your core radiological learning. And then followed by that will be a transition to practice where residents can focus on elective opportunities to ensure that they are ready for practice or fellowship. The other ongoing change that you might experience is that of COVID. Hopefully this is something that we are now beginning to see the other side of, but rest assured, when the pandemic initially made its way through Ontario, we were ready because of our open door policy to communication and stakeholder feedback, which makes up the core of our program. It was vital to ensure that none of our residents were negatively impacted in their educational experience. So let's move on to some key program highlights. We have a structured program in place with structured assessments throughout the year. Now this may seem daunting initially, but it is extremely important to ensure that residents are progressing as needed and make adjustments as needed. Ultimately, our goal is to ensure that you succeed at meeting all the requirements of the residency program and get the training that you want for your individualized careers. We have a good balance of teaching to ensure you get the clinical exposure you need, but are also exposed to dedicated teaching opportunities throughout the day. Most days, protected time is available 7:30 to 8:30 and at noon, where there are a combination of case-based and didactic teaching and/or multidisciplinary rounds. On top of that, Tuesday afternoons are dedicated academic half-days, which are protected for our residents with a rotating 2-year curriculum in place. Other unique programs we have are our Visiting Professor program, Grand Rounds, M&M Rounds, and Journal Clubs, as well as our mentorship program, which includes a vertical mentorship group, as well as informal mentoring with our monthly chair touchpoints. When applying to our residency program, research is an important aspect of your application, but the work you have done does not necessarily have to have been in the field of radiology, because we recognize it can be challenging to get this type of exposure. In our residency program, the minimum expectation is to present 1 hypothesis-based project at our internal research day, but you'll find that most of our residents have gone way beyond that, with many completing first author presentations and authorships before graduating. We are lucky to have the mentorship of Dr. Matthew McInnes, who is our current Director of Residency Research. And with this, residents have presented every year at national and international conferences, oftentimes leading many vital key projects and societies. Our faculty and department prides itself on establishing a high-quality CME program. This is evident in our flagship course, the Annual Ottawa Radiology Review, which has been the premier review course targeting residents across the country for over a decade, first having launched in 2010. Our PGY5 residents get complimentary registration and attendance for this course, without having to use their vacation or professional leave. We also have a nationally recognized Preparing for Call course, which, when it turned virtual, allowed us to make it available to residents across the country and even internationally this past year. Our PGY2 residents attend this course for free as part of their preparation for independent call. We are lucky to have a dedicated simulation program with a dedicated simulation lead, currently led by Dr. Shauna Diaganin. When you have time, please take a look at the Simulation Center video to see some of the facilities that are available. Internally, we have access to dedicated imaging phantoms for a variety of procedures that allow dedicated practice with ultrasound and CT. And our residents and faculty really enjoy getting and giving this hands-on experience. We are also proud to have dedicated access to an ultrasound simulation tool that allows our residents to get early access to the hands-on scanning techniques, particularly in gynecologic and obstetrical imaging. This ensures that when residents go on to their scanning rotations, they have the foundation available to truly build on it, working closely with the technologists. As you can see, our residents really do enjoy all aspects of the simulation program. Our program offers dedicated support in terms of learning modules, StatDX, as well as financial support for other learning opportunities, including AIRP, as well as an allowance for review courses in your senior years, a wellness allowance per year, as well as a multitude of other support when presenting at conferences. Some of you have asked how to learn about our program, our attendings, and radiology in general. The main thing I can say is to stay connected. Many of us are on various social media platforms, and some very active. It's a great opportunity to get to know us, our interests. There are lots of medical education opportunities now, especially with COVID, on some of the various social media platforms. You can also learn about our residents a little more by checking out our Instagram profile. This is currently run by the resident group and can hopefully provide you with some insight into the culture of our program over the past few years. So what does our program look for? Well, we look for individuals with academic excellence, strong work ethic, and a positive growth mindset. We want to be able to work with you to help you achieve what you need to achieve in your residency program so that you can develop a successful and fulfilling career. And we have also published about our process to make it as transparent as possible, so we'd encourage you to check out some of our recent publications on our CARMS process. So where have our residents gone? Well, many have gone on to prestigious fellowships in either Canada or the US. A select few sometimes opt to delay their fellowships to get that clinical exposure initially. Either way, whatever your career goals are, we will work with you to ensure that we can tailor your experience to achieve what you want to achieve out of your residency experience. At the same time, although some go away elsewhere, many have decided to stay on here as staff at the Ottawa Hospital. And that is probably one of the most important strengths of our program. We're eager to train you because we hope one day soon you will become one of our colleagues. And it is because of that that our program was nominated for this prestigious award by the residents and was actually successful in receiving the Paro Residency Excellent Award. This was a massive honor and we are so proud to have achieved this acknowledgement. So thank you for your time and check us out more on social media. Good luck with your entire CARMS process.